hasn't been on.
I didn't,
Yeah.
I just wanted the edge.
It's just stupid.
And he gets lost what he's saying, he's
Yeah.
just gone. He said he was pumping it for about 4.5 years.
Oh, is that right? Oh, jeez. Well, see, that can blow out your liver, can blow out your kidneys.
And he says he goes to, sometimes he goes to dialysis.
Oh, okay, so it messed up his kidneys.
Yeah.
For
He
just
still teaches though, he is.
For just 4.5 years of steroid use. He's probably going to die young.
Probably down already.
Yeah, it's lucky he's not dead already. Exactly. This is what skin popping looks like. As you can see, the scars. I had a friend back up at Fort Belknap who was a skin popper, who had been a skin popper. He was a Marine in Vietnam, and he started popping over there because he couldn't stand needles. So he'd take a really tiny needle and he'd stick it underneath the surface of his skin and shoot up with heroin, which is the dumbest thing in the world that you can do. And it was kind of cool because all of his scars were perfectly circular. It was like somebody took a bottle or something, something circular, and just punched holes all over his arm. It was just really kind of interesting. Not the, it wasn't well. That's pretty unattractive. It takes about 3 to 5 minutes if you skin pop to get it into your system, just like intramuscular. It doesn't create a head rush, and it's really relatively slow. People complain about it. He's not really dead. Injection is the most dangerous method of introducing drugs into the body because once they enter the body, there is no way of turning back. Injecting also introduces the user to a whole host of contaminating infections, such as hepatitis B and C, syphilis, and HIV. Of course, I was in medicine before HIV, there was any HIV. The only thing we were afraid of is hepatitis B and syphilis. Hepatitis C developed mutated out of hepatitis B, then all of a sudden we had hepatitis C. Hepatitis C and HIV, and everybody was just scared to death because all of a sudden these guys were injecting, they were injecting themselves, and there were new problems out there that would kill them. Hepatitis C, of course, they just developed a medication to eradicate it. Before that, a year and a half ago, there was nothing you could do about hepatitis C. You would die with hepatitis C. The individual is also more prone to abscesses and embolisms. Embolisms, of course, are blood clots. When you inject yourself with drugs, one of the things that you are doing, it's very toxic. It's a very toxic substance. So you're actually destroying your blood vessel. Normally, the body has a way of rerouting the blood so that you don't lose your hand because you injected yourself. But blood clots are very, very common. If a blood clot breaks loose, it can get into your brain and cause a stroke. If it gets into your kidney, it can blow out your kidney. If it gets into your lung, it can kill you. This is
hepatitis alpha.
Oh, hepatitis A?
Is there?
Yeah, there is.
B and C.
Yeah, there is a hepatitis A, but it's not very common. It's not very infective.
Oh.
B is the one that we see more often. C, of course, is a relatively new one. There's also a D and an E, hepatitis D and E, but we don't see those at all.
So the higher the letter, more dangerous? Or?
No, it just happened. It started with A, and hepatitis A wasn't a very serious infection, and then they developed, it mutated into hepatitis B, mutated into a more virulent form, and that was hepatitis B, which was highly infective, but it doesn't destroy your liver. And then hepatitis B mutated into hepatitis C, and hepatitis C is very virulent, and it does destroy the liver.
How much time
I'm sorry?
does it destroy your liver?
It all depends on how badly you get it. It all depends on your genetics. Depends on there's a lot of.
Once you have it, then you have it.
Once you have it, you've got it for life. Some people have a form of hepatitis C that destroys their liver and it kills them fairly quickly. Other people have hepatitis C and hardly does any damage to their liver. Other individuals will get it and it will just kind of linger, and they have a yellow pallor all the time, which means their liver's breaking down. You know, they can last for a decade, 15 years. It really all depends on your genetics, as weird as that is. If you watch television, you see advertisements, they have a new medication that can eradicate hepatitis C. And people will say, oh, I've got the kind that doesn't really bother, I've had it for 15 years and I don't see any effects from it. Another guy says, well, I got it, it's very effective and it's destroying my liver, that kind of thing. And it really all depends.
So it's situational.
It's relatively situational. And when we talk about genes, we're really talking about races. African Americans, when they get hepatitis C, it's really bad for African Americans just because of their genetic makeup. It's fairly bad for Hispanics and American Indians as well.
What if you're mixed?
I'm sorry?
What if you're mixed like me?
Oh, well, I don't know.
Shot in the dark, huh?
I don't know. Yeah. The question is, is your liver more a white liver, or is it a Hispanic liver, or is it a native liver? That's the
I
question.
don't know, it's looking like the Italian flag, man.
There you go. Yeah, exactly. And we're going to talk about that, and I think we're going to talk about that when we talk about, white people have been drinking alcohol for thousands of years.
I don't know, I met like, my mom's mom, she's from Belfast.
Mm-hmm. Oh, she's from Ireland.
Yeah.
Okay.
And I was all like, dang, man, she would, before she went to sleep, she would always have a bottle of Bushmills in her cupboard. I mean, as average as you can fucking get.
Sure.
But she would just have like a little, it looked like a fancy shot glass. Just go like that and then just...
Knock her right out, huh?
Yeah. But then my grandfather, he would drink like Reposado, like tequila or... like he knew how to do it from the agave plant. Like he could freaking do it.
Oh, so he could make his own.
The mezcal.
Oh, he made mezcal. That stuff's nasty.
Yeah, well,
It's pretty strong stuff.
yeah.
It's kind of like the vodka of
He also liked Jameson. This is another famous.
Sure. Yeah, that's fairly smooth whiskey. Yeah. Okay, we've got other ways to do this. We can snort the drugs into our nose, and it will affect our mucous membranes. We have mucous membranes all over our bodies, starting with our nose. If you stick your finger up your nose, that's moist tissue that you feel is mucous membrane. If you stick your finger up your butt, that moist tissue that you feel is mucous membrane. Yeah. You have mucous membrane that runs all through your digestive system. The soft tissue in your mouth, that's all mucous membrane. Some psychoactive substances that come in a powdered form can be inhaled through the nose and absorbed in the capillaries found in the mucous membrane. This works with cocaine, of course, is a powdered form. Heroin's in a powdered form, so you can snort that. Methamphetamines or ground up OxyContin, you can snort all of those things. If you're used to snorting cocaine and you snort heroin like we saw in that strange movie,
Pulp Fiction.
Pulp Fiction, yeah.
It's too much.
It can shock your system. It can stop your heart from beating, as weird as that is. There's other methods of getting this stuff into your system. Besides snorting through the nose, there are two other methods used. It's like snuff. You can put it between your cheek and gums. This is very delicate tissue. Your cheek and your gums, it's all mucous membrane. It can get into your system that way. What they have done with snuff is that they have put in glass, fiberglass. There's fiberglass fibers in snuff so that it cuts your lip and it cuts your gums, and so the nicotine gets into your system faster.
I don't know, I did, so.
Yeah, I mean,
But I never did before the army.
or is that right?
But when I was a drill sergeant, man, you're waking up at 3, 4 o'clock in the morning.
You need a little buzz going.
It wakes you up, it really
There you go.
does.
There you go. It's because of that fiberglass. You're smart for stopping. That's-
No, I don't know.
You haven't
It's
stopped.
just, instead of like a can lasting me like 2 days.
Sure.
It lasts me almost 6, so I've slowed down.
Right.
So, I mean, it's steps.
Yeah, this is really kind of dangerous because you're cutting yourself. I mean, it's like cutting your wrist and then pouring the drug into the open sore. That's exactly what's going on with this.
But, another drill sergeant, he used Red Man, and that's straight.
Yeah, well, he chewed it, but the good thing about chewing tobacco is that you've got your salivary glands, you've got your salivary glands, and it's breaking down the nicotine. And there's no sores, you're not dealing with any open wounds. But if you get snuff, you've got an open wound, a constant open wound in your mouth, especially if you do it on the same side every time. If you switch sides, you know, then it's not nearly as bad.
Well, I mean, I've been doing it for maybe, well, off and on for about 6 years.
Yeah.
But I mean, things are fine.
Not yet, yeah. Well, you're still not very old.
Well, that's how Tony Gwynn died.
I'm sorry?
That's how Tony Gwynn died.
Yeah, Tony Gwynn,
He
exactly.
had throat cancer.
Yeah, exactly, exactly. And
But
so they've
he's been
stopped
doing
it, they've stopped
years.
it in baseball. Yeah, you're right. People that chew tobacco, they'll get cancer in their salivary glands, they'll get cancer in their throat, they'll get cancer, jaw cancer. I had a friend that chewed tobacco, he was a judge, and he chewed tobacco and spit, of course, when he was pissed off and standing in front of everybody. On his bench, he would spit, you know, and show everybody how pissed off he was. He lost all the muscles on the left side of his face. So it got into his salivary glands. He had to have his salivary glands taken out. And now he can't lift his head. His chin is permanently stuck on his chest like this. So he walks around like this because he's lost all the muscles over on the left side of his
I
head.
think that's been one of my wife's family members. Pretty much right here, like from the bone,
Yeah.
is gone. So this looks like it's sunken in.
Isn't that attractive? No, okay. Freud was a cigar smoker, and he almost always had a cigar in his mouth. Well, he had cancer of the jaw, and they had to take out half of his jaw, and he had a silver prosthesis that he would put in so that he could talk. He said it was the dumbest thing, the most horrible thing that had ever happened to him was having to put that prosthesis in, so that he could.
Another person died was like Eddie Money.
Eddie Money.
He died actually just recently.
Yeah, exactly. Yeah, just about.
He had throat cancer.
Exactly. It's dumb.
But my wife always says, well, I'd rather you did than smoke. So, that's catch-22 right there.
There is catch-22. All that stuff, tobacco is very toxic, and it's gonna catch you one way or the
But
other.
it calms me down, otherwise I'd probably let holes in my
Okay, well, as long as it works. So you gotta, what's your
'Cause
poison, I guess?
I quit drinking,
Sure.
you know? So, I mean, out here, you kind of get cabin fever. I mean, both people should know that, you know? And
How do you survive out here without doing something? Sublingually, if I had a heart attack right now, we could stop my heart attack potentially by putting TNT under my, by putting, what is that stuff that they put in there? Wait a minute. It's the stuff that explodes. You, I can't think of it. Anyway, you can put it under your tongue. Now, the funny part is, of course, if you put something under your tongue, the salivary juices don't get to it, but it can be absorbed very rapidly into your system. Jeez.
What are you trying to look, what are you
I'm
trying
trying to think of what that stuff is. It's the stuff in TNT. I don't, it's left my brain. I'm completely confused. Other ways of getting stuff into your system, this is a picture.
Trinitrotoluene?
No. What is TNT? TNT is tetra. Oh, what's
No,
wrong?
it says it's trinitrotoluene. I'm not sure if I'm saying it right.
No, that's not it.
So right here it's got
It'll
the-
come to me in a minute, okay. I'm just having a brain fart. You can absorb drugs into any of your mucous membranes. People will stick things in their rectum. Nitrous oxide, it's not the right stuff. Anyway, they'll stick stuff up into their rectum to excite themselves. Women have been known to soak tampons in alcohol and then insert them into their vaginas so that they can get drunk faster. It's a really dumb way of
Just drink.
getting drunk. Yeah, just take some
Shots.
shots. Yeah, exactly. Why do they do it that way? I'm not exactly sure. They can't have sex afterwards for a while because it dries out their mucous membrane. But this is some of the things that people do. They'll take a tampon, they'll soak it with alcohol, they'll stick it up their rectum, and of course it'll be absorbed into the system. People will do this going into football games because they're not supposed to carry bottles into the football games. They don't know how to sneak something in, so they'll do this kind of silly stuff.
Yeah.
Working in the emergency room, I've seen all kinds of really interesting and strange things that people will do to themselves. This is usually administered as a suppository, but it can also be used for recreational drugs. Cocaine, you can impregnate something with cocaine and stick it up your butt or shove it into your
Well, I
vagina.
heard of people doing that in prison, but that's just to get the product in.
Well, that's to hide it, yeah, they
But
can,
I don't know, that's a whole different ballgame.
sure. What they will do is they will, this is why they do a cavity search. They'll take a condom and they will put the drugs inside the condom, then they'll stick the condom, the solid condom up their rectum, and then when they go to the bathroom, they'll pull all that stuff out and then they distribute it. And this is how one of the ways that they sneak drugs into prisons is by sticking it up their butts. And this is the reason that they do a cavity check when somebody first comes into a prison, because they need to make sure that they're not hiding something. And this is a great way to hide things. As long as it's covered in plastic, there should be no problem. They smuggle drugs into the United States by swallowing condoms full of drugs. But sometimes the condoms break, and if it breaks into the
Okay.
yeah, they die. They die of a massive overdose. Oral ingestion, when a drug is swallowed, it goes through the esophagus into the stomach, passes into the small intestine where it is absorbed by capillaries in the mucosal lining of the intestine. This method requires between 20 to 30 minutes before the drug begins to affect the brain. So if you take an aspirin, you get a headache, you take an aspirin, it should take about 20 to 30 minutes before you start getting any relief. But that's not the way it works. If you take a pill, you start getting relief almost right away. Well, that's impossible. It hasn't been in your system long enough for you to get it into your system. So how in the world does your pain go away? Well, that's known as a placebo effect. You think that it's going to work, so it does work, and it starts working right away. So if we can convince you that something's going to affect you in a select way, you will.
It's a mind
Sorry?
fuck.
Yeah, sure. Exactly.
I don't know, I take ibuprofen, I don't know, man. If you can get shot in the servers, they give you ibuprofen, you know, Ranger candy. And I'm like, this just sucks.
Ibuprofen doesn't, I can't take ibuprofen.
I think I've taken so many years for so many injuries that it just doesn't do anything to me.
It may not have done anything to you to begin with. That you were taking it and because you thought it was supposed to work, it did work. That's possible. It doesn't work on me. Well, it does work actually, but I have a negative reaction to ibuprofen. I get depressed. It's not like it does anything else, but I just get depressed when I take it. Yeah. Now that's not an uncommon reaction to ibuprofen. 5 to 10% of the population has the same reaction that I do. Of course, they never tell you that. So I was taking ibuprofen, I had a knee injury, and I was running, and I was taking ibuprofen, then going out and running, and I felt like killing myself. I felt like stepping...
It's an anti-inflammatory, right?
It's an anti-inflammatory. But I get depressed when I take it. So if I took one right now, this afternoon I would be just I'd be a mess. I'd feel like a gray snake crawling on the ground. It's that bad. I get really, really depressed from taking ibuprofen.
Doesn't matter the dosage?
Yeah, it doesn't matter. I just stay away from it. I can't take it. If a psychoactive substance is a beer or other alcoholic beverages, about 10 to 20% of the substance will be metabolized by the stomach. Males tend to metabolize alcohol faster than women, and thus they get drunk slower than a woman who consumes the same amount of liquor. And this is one of the problems for women. They don't have as much alcohol dehydrogenase in their stomach as males do. Males have been drinking a lot to excess for an extended length of time, thousands of years. So males have developed this ability to metabolize alcohol much faster than females do. Females, of course, don't drink during pregnancy. Females weren't supposed to drink nearly as much as men did for an extended length of time in all kinds of different cultures. So men evolved with more alcohol dehydrogenase in their stomachs than women have. Most psychoactive substances are fat soluble, and so they move readily through across membranes. Alcohol is both fat and water soluble, and this is one of the reasons why it gets into your brain so rapidly. Yeah, well, he's pretty drunk. Transdermal absorption, drugs are now being impregnated on adhesive patches so that the medication can be slowly absorbed through the skin. Some of these patches provide medication for up to 7 days, though it may take as long as 2 days before a therapeutic level of the drug makes it into the system. They have a new birth control patch that women wear. It's got Depo-Provera on it.
Is that the same concept as like the nicotine patch?
The nicotine patch, it's exactly the same. Yeah, same thing. But it may take 2 days to get enough of that stuff.
I know this older guy, he has the patch, he smokes and he dips. Oh, no, he's not like getting sick, he goes, it's a skill. He's an old, yeah, he's from Vietnam. He's one of the guys.
He's lucky he's still alive.
Yeah.
If he's got a dose of nicotine in his system. Because of various factors, psychoactive substances in the blood do not remain in the system for the same length of time. And this is known as bioavailability. There are various factors that restrict the availability of psychoactive substances to the target tissue after administration. Once the psychoactive substance enters the bloodstream, it can be transported either inside the blood cells themselves, the red cells themselves. Sometimes it is transported in the plasma, which is the liquid portion of the blood. They can attach themselves to protein molecules that are floating around in the blood. It all depends. A psychoactive substance will visit every organ in the body where it will either cause an effect, be ignored by the organ, be stored usually in fat cells, or be biotransformed. It's broken down into various chemical formations. This is the way it works with Valium. When you take Valium, Valium has a select effect, but one of the reasons why it's so effective in your system is because it breaks down into five different chemicals, and all of them are psychoactive. Well, the chemical structure of the drug is a factor in distribution, so is the size of the individual. A lighter person with less blood volume will have less blood to dilute the chemical. The blood volume of an adult is 6 to 8 quarts of blood. And if you've ever seen anybody bleed out, then you know that it really is 6 to 8 quarts of blood. Children may have 3 to 4 quarts of blood, not nearly as much. Organs with extensive vascularization will be affected by a drug to a greater degree. This is one of the reasons why cocaine can cause a fatal heart reaction. Too much of the drug affects the highly vascularized heart, causing arrest.
I have a question. Okay, well, I know the blood is blue to oxygenates it, it turns red, right?
Well, it's maroon, I would say.
But
You can call it blue if you want.
I've seen like people shot and it's like almost black. Is it just really super dark red?
Well, and then it turned red sitting on the ground. Isn't that the way it works?
But initially, when
It
the
looks
goes
black.
in, so it is black? Or is it
It's
just
not really
dark red?
black. Well, like I said, I see it as maroon. You can see it. It's pretty dark.
But then like when it starts flowing out, then it turns like
Turns red. I know, it's bizarre. It comes out purple and it ends up. I call it maroon. You can call it black if you like, but it's pretty damn dark. My job was to draw blood, and of course I'm drawing it up into a tube, and there's no oxygen in the tube,
So it's just straight dark?
so it's pretty damn dark. Well, depending on the individual. If it's a male, it's darker than if it's a female, because males have more blood cells in their blood. It's not black like that. It's this color, I would say.
Yeah, it's like I'd say it's like a dark purple.
Exactly.
Cause like I'm like you're in a fight, you ain't got time to freaking analyze it.
Right, yeah.
You gotta get them out of there, whatever.
Right.
But I was just like, for a quick second, I'm like, why is this shit black?
Yeah.
Fuck it, gonna matter back his ass up.
Well, and it's kind of interesting, as a medic, that's one of the things I look at. I try to determine, does he have a open artery, or does he have an open vein? If it's a vein, you don't have to worry about it, because you don't usually bleed out from a vein, but if it's an artery, you can bleed out real quick. So if he's got, bright red blood pumping out of his body, you got to stop that bleeding almost right away, any way that you can. Otherwise, he's gonna bleed out. So what you need to do is
Tourniquet.
tourniquet. If you can put a tourniquet, but you can't put a tourniquet on somebody's thorax. You just stop the bleeding any way that you can.
Well, they had this stuff called Quick Clot, but they took it off. But I guess they redid it because it was actually infecting the wounds.
I can see that.
But they redid it or whatever, and I guess it's better now. It's like that powdery white stuff.
Yeah.
You pour it, and it's supposed to clot it, pretty much.
I can see another problem with that. If that gets into your system, it could cause blood clots in your brain and cause a stroke.
Yeah, I
And
think
I'll
was
bet
one.
that happened a couple times,
Yeah.
more than once. Humans would have died from bacteria, viruses, and toxins at the beginning of our evolution if it weren't for our ability to keep most of these substances out of our central nervous system. The walls of the capillaries that feed the nervous system consist of tightly sealed epithelial cells that only allow certain substances to penetrate, and this is known as your blood-brain barrier. It's a damn good thing that we have the blood-brain barrier, otherwise we would have died out a long time ago. Luckily for those who need a chemical assistance on their lucidity, psychoactive medications do cross the blood-brain barrier and change serotonin, GABA, or whatever neurotransmitter we're dealing with, dopamine, to reduce the symptoms of depression, anxiety, or whatever. So if we're trying to, if somebody's depressed, if we can increase their serotonin level, they'll feel better. If somebody's overly anxious, we can increase their GABA level, and that will make them not so anxious. So we can actually cure people, we can actually make people feel better by increasing select neurotransmitters. And that's what Prozac does. Prozac is a selective serotonin reuptake inhibitor. It forces more serotonin into the synaptic cleft, and because there's more serotonin there, you feel better. It makes you feel better.
I was prescribed that, and Zoloft, but then I had to take something else as a side effect
Okay.
of SSRI.
Yeah.
The name of it.
See, that's the
It's
problem.
like an ongoing.
Exactly. It's a cycle. You take this and it makes you happier, but now you got this
You gotta
other
take
side
this to combat
effect.
that.
So now you have to take a
It's
third
just-
drug in order. Yeah, exactly. That's just dumb. The chemicals that people use as psychoactive substances also will cross the blood-brain barrier. Otherwise, they wouldn't be taken since there wouldn't be a brain reaction to them. The reason psychoactive substances cross the blood-brain barrier is because the brain is very fatty, and most psychoactive substances are fat-soluble or lipophilic. Nicotine is especially lipophilic, and since nicotine gets into your brain so rapidly, that's why it is so addictive. Alcohol is the same way, and marijuana, unfortunately, is the same way. So how long does it stay into your system? Amphetamines 2 to 4 days, barbiturates 4 to 7 days, benzodiazepines 3 to 7 days, cocaine 2 to 4 days, ecstasy 1 to 3 days, methadone 3 to 5 days, methamphetamine 3 to 5 days, the opiates 2 to 4 days, phencyclidine PCP 7 to 14 days, THC and marijuana 15 to 30 days. The tricyclic antidepressants, 7 to 10 days, propoxyphene, 1 to 2 days, oxycodone, 2 to 4 days, amphetamines, 2 to 4 days, cocaine, 2 to 4 days, and
Then
methamphetamine.
again, it's all depends how much you smoke.
Yeah,
If
exactly.
you get an 8 ball of freaking dope,
Yeah.
and you smoke it all, you're gonna be high for at least 2
Yeah,
months.
you're gonna be messed up for a while, exactly. Drugs that are completely fat soluble will cross the blood-brain barrier very rapidly. Drugs that are only partially fat soluble will cross the barrier much slower. This is one of the things that we have to look at if a woman is pregnant, because she's got a baby whose brain is developing, and we need to make sure that that medication isn't going to get into the baby's system. From time to time, we have given women who were pregnant drugs that actually affected the baby. If you give a baby sulfa drugs, if you give a fetus sulfa drugs, it will make them blind. So we can't do that. We need to make sure that the woman isn't pregnant when we give her those drugs. If she is pregnant, her baby's going to be born blind, and that we certainly don't want to do
But
that.
in some cases, do you have to like they say the moms they're taking eggs, right? And because I mean, everything that the woman eats, drinks, intakes, goes straight to the baby.
Right.
Obviously.
But some things don't cross the blood-brain barrier. That's one of the,
But would
most
you
of the
have to give-
medications, as long as it's water soluble, it's not going to cross the blood-brain barrier.
But would you have to give the baby like extra dosages of it to keep it?
Keep it alive?
Yeah.
You mean after the baby's born? That's what happens with heroin or crystal meth or cocaine. When I was working in NICU in Omaha, it was right at the beginning of the cocaine. Everybody was using cocaine. This is back in the 80s, and everybody was using cocaine. So we would get babies that were addicted to cocaine. But you don't know how much to give the baby. There's nothing you can do about it. You just have to bleed it out of their systems. So you'd start an IV on the baby and you'd pump fluid through its system, trying to accelerate the process of weaning the baby off of the drug, but you can't give the baby the drug because you'll kill it. So we just had to wait.
Did it work?
until it cleaned out of the system. How long did it take to clean it out of the system? It all depended on how much the mother used. Sometimes the baby would not survive. The babies just couldn't handle it. I mean, they're going through withdrawals. It's a brand new born baby. How strong is that thing? Yeah, that's
No immunity system,
no
nothing.
immunity, exactly. The liver isn't completely functional yet. The liver won't be completely functional for 2 years. So we had to wait and, we had to just treat the baby and monitor it for 24 hours. And of course, you do that anyway, but he just had to wait. It took my great nephew 6 weeks to get off of heroin because his mother was an addict and she used during pregnancy. And it took him 6 weeks before he was normal. So he went through 6 weeks of hell.
I had a buddy of mine, they weren't together, but it's just one of them things,
Sure.
Shit happens. But after she gave birth, she was going straight to jail. She was done. California, 3 strikes.
Right.
Done. So he's the dad, my friend, he goes, I don't know what to do, man. He's freaking hooked. He was in there, we call it ICU,
Yeah.
for almost 8 months.
Yeah.
And it was finally out of his freaking system. It was meth. And now he's good. He's a pastor now.
Sure.
You know?
Sure. Now he's good, but it's getting them over that initial problem. The other problem that he's a pastor now?
My friend is.
Your friend's a pastor, and the kid's okay?
Yeah.
Okay.
He's good.
The kid's more susceptible to addiction is the problem.
Yeah, he tries to watch him, like, he told me, he goes, man, if you don't give your kids a little bit of freedom,
Right.
then they're gonna rebel and then
Right.
you're screwed.
And then you don't know what's gonna happen. Exactly.
So, like, he goes, the leash is a lot longer than,
Right.
Yeah, that's good,
Wow. Hope everything turns out okay. Oh, I'm sorry, I didn't get all the way through this.
And the mom, she's dead in prison.
Oh,
It's a
she's,
gang thing, I guess, got shanked about 9 times. Women are more crazy than men.
I'm not gonna argue that point. Drugs that are only partially fat soluble will cross the barrier much slower. Now we're talking about medications. This is one of the reasons why when a woman is pregnant, that the doctor will be very, very careful as to what pharmaceuticals they give them. An individual that has bipolar disorder and needs to stay on her medication so that she is normal, they will have to take her off of her medication. If a woman who is schizophrenic and is the only way that she can regulate herself is by staying on those medications, they have to take her off those
medications
while she's pregnant for those 9 months. So there's always a decision that has to be made. Can we take her off of her medication in order for her to have this baby? And it's a decision that the doctor has to make, that the woman has to make, and that usually her partner has to make. They have to decide what's going to happen next. Because that's tough. She's normal as long as she's on her medication, but when she's off her medication, she has psychotic episodes. So what do you do?
What would you do?
What would I do? Well, first of all, I wouldn't marry a woman who was psychotic.
Well, you're the doctor.
I'm the doctor. Okay, so I'm the doctor, and I've got a client or a patient who's schizophrenic, and she's pregnant. So what would I do? Well, it's up to her to begin with. I'd take her off the medication right away. And some people can't handle being psychotic. It's just too distressing, too traumatic for them.
But is there a guarantee that medication will harm the baby?
Well, it will. I mean, it will kill the baby. The baby cannot be.
What do you take for that, like lithium or something? Or what do you take?
Lithium is a heavy metal, and it really messes up your liver. it can potentially mess up your liver. Well, the baby, you can't take lithium while you're
Oh, no.
pregnant, yeah.
That is it.
Yeah, everything will just be screwed up. So they have to go off their medication in order to have a normal baby. I know, this is a rough decision to make. What would I suggest that they do? I would suggest that she not get pregnant.
What was your is? She's already 6
She's already
months in?
pregnant, I would suggest she get an abortion.
Yeah. Let's go, Bruce.
It's just the way it
But
works.
again, I mean, it's the less.
But it's like I said-
Evils, I guess.
It's up to her. I mean, it's really up to her. If she can handle the psychosis, and potentially, you know, what happens during pregnancy, she's gonna have an increase of progesterone, which makes women happy. You've been around pregnant, or were you around your wife when she was pregnant? No, you were deployed the whole
For
time.
the first 2 months, and then I had to go to the stand.
Yeah, yeah. So you weren't really around her during most of her pregnancy. Usually during pregnancy, women have a higher progesterone level, and it really changes their moods. It makes them happier. A lot of women like to be pregnant because it makes them feel so good. So, you know, potentially that would create a situation where where her psychosis wouldn't be nearly as bad because of the increased hormones in her system. But if she were having a negative reaction, you know, it's part of the problem is it may destroy the baby anyway. Her psychosis, she may do something to herself and hurt the baby anyway.
So you said that women tend to be happier when they're pregnant.
Oh, yeah.
Well, then how does it, after it's gone, postpartum sets in?
Postpartum depression.
Yeah.
That's why they have postpartum depression. There's such a
So
vast...
there's such a high and then boom.
Exactly. It's like a crash. That's where postpartum depression comes in. Statistics tell us about 80% of women have the baby blues. They get kind of depressed after their pregnancy. 80%, which is a lot of unhappy people. But the reason is because, you know, the estrogen levels and progesterone levels are different during pregnancy, so it makes them feel much, much better. As weird as that is. Anyway, so it's like I said, it's up to her. It's not really up to me. But I would suggest her not getting pregnant. If she does get pregnant, then and she can't handle the change in hormones, some women have will go into psychosis during pregnancy. So yeah, and then they will stay that way. It kicks them into psychosis, and it's known as postpartum psychosis if they maintain it through after their pregnancy.
And it just lasts?
Well, it's forever. It's permanent. Yeah, I know. Some women want to kill their babies after they have babies. They want to kill them, and that's postpartum psychosis. Yeah, but it happens. It's just
Oh, yeah, I've seen it in the news. Yeah, it's messed up.
nutty stuff. This form of crossing the barrier is known as passive transport, where if it crosses the barrier slower, because it's partially fat soluble and water soluble, it will cross slower. So if you shoot up with heroin, heroin is fat soluble, it crosses the brain-blood barrier very rapidly. If they give you morphine or you're shooting up with morphine, morphine crosses the barrier much slower because it's both water and fat soluble, and this is known as passive transport. And it's one of the reasons why morphine is used as an anesthetic, and you can't use heroin. Heroin crosses the blood-brain barrier very rapidly, but morphine, of course, cannot do that. Active transportation takes place when a water-soluble or hydrophilic chemical needs to cross the blood-brain barrier. The water-soluble chemical must first attach itself to a chemical structure that will readily cross the barrier. In the case of cocaine, cocaine hydrochloride attaches itself to protein molecules. Most water-soluble substances, such as antibiotics, do not cross the barrier. And this is one of the reasons why we can treat a pregnant woman with antibiotics, almost all antibiotics. Some of them do cross the blood-brain barrier, like sulfa drugs. So we have to keep her away from sulfa drugs. But antibiotics will not cross the blood-brain barrier. We don't have to worry about it getting into the baby's system. The blood-brain barrier does not completely develop until the individual is 1 or 2 years old. So the baby, the fetus, and the baby when it's a year old is very susceptible to anything that's happening to it. So let's say the mother smokes dope. Let's say she smokes crystal meth. That crystal meth, it's in the air and the baby is ingesting it at the same time. So she's actually doing damage to the baby if it's a brand new born baby before it turns 2 years old. She's actually injuring that baby. If she's smoking pot, the same situation is taking place. Parents who smoke pot around their newborn are actually changing the structure of the baby's brain. This is a really serious problem because there are 11 states in the union which allow recreational marijuana usage. If these people are so stupid, which is not that uncommon, that they don't understand what's going on and they smoke dope around their kid, then they're actually...
Yeah, that's just stupid. I mean, at least go in the other room.
Somebody should just shoot them. As stupid as that. But it happens, and people are dumb. People think, well, geez, if they let me smoke pot, then evidently it doesn't hurt anything. And so they'll do all kinds of stupid stuff. I had a student in Mississippi who would, if his kid was crying, he would blow marijuana smoke in his face. And it would stop the baby from crying.
Oh, yeah, because I don't know what the hell is going on.
Somebody should have just pumped that guy full of bullets or something. I mean, that's just dumb. Toxic chemicals will not injure, and of course that changes the baby's brain structure. Toxic chemicals that will not injure adults cross an infant's barrier and cause brain damage, and of course marijuana is one of the substances that will rearrange your brain. Unfortunately, part of the brain that it rearranges is your short-term memory. So it doesn't really destroy the baby's short-term memory, it makes it less functional. So if I say something to somebody who's stoned, they can't remember it 30 seconds later. And that kind of stuff happens to the baby. The placental barrier protects, it lowers their IQ, as sad as that is. The placental barrier protects the developing fetus from water-soluble chemicals, but since most psychoactive substances are fat-soluble, the fetus uses what the mother uses. So when she drinks alcohol and she's pregnant, the alcohol goes directly to the baby's brain. When she smokes dope and she's pregnant, the dope goes directly to the baby's brain. So in essence, she's rearranging the baby's brain. Is she making the child more intelligent? No, she's destroying the baby's short-term memory. She is injuring the baby's short-term memory. So the problem is, now that we have 11 states where recreational marijuana is legal, what we're going to see is a change in society to the extent that potentially the kids in Colorado, the kids in California, the kids in Washington and Oregon and Massachusetts, Washington, D.C., Illinois now has legalized marijuana. What we're going to see is lower IQ scores in the future, potentially.
I don't know, I see people that smoke and they're fucking straight A's, man.
So what would they have done if they didn't?
No, but I'm just saying, probably the same.
No, that's what everybody's saying, probably the same.
No, but I'm saying it all depends on the individual, but my friend, it makes him concentrate more, and this guy gets fucking scores like fucking
Sure.
crazy.
But how smart would he be if he didn't smoke pot?
He was smart before. About the same.
Well, we don't know. I mean, we don't know. We don't know how much smarter he would be if he.
Well, I've known him
didn't-
his whole life.
Yeah.
You know, he just barely started smoking maybe 3 years ago.
Okay.
So, I mean, he's always kind of a nerd.
What we're really talking about is, the research tells us that if you start smoking before age 12, it rearranges your brain.
Oh, no.
Yeah, as long as you don't start until your adulthood, you're probably okay. You're really not changing things. But the problem is, we can't keep these kids away from drugs. We can't keep them away from alcohol. How in the world are we gonna keep them away from pot? That's the problem.
It's where heavy parenting slips in.
Yeah. The body is always trying to rid itself of foreign substances, whether they are harmful or helpful. It does this in two different ways. Metabolism, processing, using, and inactivating the substance. Most of this takes place in the liver. This is one of the reasons why when you get drunk, it takes you a couple hours to start sobering up. Why are you sobering up? Because your liver is metabolizing that alcohol. It's breaking it down, and it's getting it out of your system. The other way of getting the substance out of your system is excretion, expelling the foreign substance and its metabolites from the body. This takes place in the kidneys. Once again, we're talking about the substance being in your blood. It runs through your kidneys, the kidneys filter it out. They send it to the liver tries to metabolize it. What it can't metabolize, of course, it keeps circulating. And this is a reason why you stay drunk, because it can only metabolize a select amount of alcohol in any given hour. When the liver metabolizes alcohol, it breaks it down into water and carbon dioxide and excretes it from the body through the urinary tract, the sweat, and as vapor from the lungs. I've had people come into the emergency room and we knew right away that this person was drunk as a skunk. Why? Well, when they breathed on you, you could smell the alcohol. You could smell it on their sweat. One of the jobs I had was drawing blood alcohol levels. So you would draw a tube of blood, you take it back to the laboratory, and you would find out how much blood was in their blood. You could pop the cork on that tube and sniff it, and you could tell how much alcohol they had in their system. You could smell the alcohol in their blood.
Are those breathalyzers accurate?
Yeah.
Like, how does it do it? I mean, of course it would be on there, because, I mean, you just drink, yeah, the smell and everything will be in your mouth. I mean, taste buds and all that.
Well, they're getting,
Where does it come from?
have you ever had a breathalyzer? Okay.
I've had DI before, I'm a grunt.
Yeah, so what they're doing is they're making you breathe. They'll say breathe into the tube and don't stop until I tell you to. And so you'll go. And what you're doing is you're emptying your lungs of air is what you're doing. And so what they're getting is how much is actually in your. This isn't what you've drunk. This is what's circulating in your blood. That's what the breathalyzer is detecting. Because the alcohol in your lungs is the alcohol from your blood. It's not from your stomach. So if you just took a drink of alcohol and did a breathalyzer test, it wouldn't be positive at all, because it hasn't broken down in your stomach yet. You haven't started, it hasn't started circulating in your blood. So if you drank a couple beers and then ran outside and they did a breathalyzer test on you, you wouldn't have a positive test at all.
No, mine was pretty high. I was.
Yeah, well, you've been
about,
drinking.
1.2.
Yeah, you've been drinking, and that's really drunk.
Yeah, but I was just driving around. But the thing was, they were like, we need to get rid of that bottle. I got stopped by Texas Rangers.
Ah.
And I just threw it on the freeway, and then that was it.
They didn't arrest you for throwing a bottle on the freeway.
They didn't give me the breathalyzer until freaking, no, what happened was I missed a stoplight.
Okay.
They didn't give me the breathalyzer until the jail. Well, I'm sure he smelled it on me anyways.
Right. Now, you're thinking he was being nice to you because he waited until you got to the jail before he did the breathalyzer. But if you'd been drinking, that alcohol that's in your stomach, remember, it takes 20 to 30 minutes for something to get into your system from your stomach. So if he transported you to the jail, then the alcohol that was in your stomach that you had just ingested is now in your bloodstream. So you would have had a higher blood alcohol level on the breathalyzer test than you would have if he had taken it right
It was
away.
pretty high. The guys are like, I'm surprised you're standing.
There you go.
I don't know. Just do what you gotta do.
Now, it's funny that he made you throw your bottle away because well, I guess they changed the law. For the longest time, they had an open container law in Texas. You could have an open container in your car. Most states, if you have an open container in the car, they immediately arrest you. They can impound your car, you know, the whole thing.
It was crazy, in Georgia, a soldier of mine had gotten, he got DUI, right? And he was walking from the store with a 12-pack, right? When he got out of jail, they gave him his 12-pack back. I was all, why? He goes, well, it's his property. Sir. I'm like,
Sure, they gave him
Right.
his 12-pack back. Of course they did.
it was in, what county?
Was it Fort Bragg, wasn't it?
No, it's Georgia. It was,
Fort Bragg's
that's
in
North
Columbus,
Carolina.
Georgia.
No,
Not Fort
Fort
Bragg.
Bragg, North Carolina.
What am I thinking? What's the one in
Benning.
Columbus?
Benning.
Benning, Fort Benning, that's right. It wasn't,
But yeah, they just gave him his freaking 12-pack. So this, or you want to jail?
well, they're used to military people anyway.
Yeah.
The liver breaks valium and other metabolites that are actually active in themselves and affect the brain. Of course, this is Lindsay Lohan in her drinking phase. Evidently, she's not drinking so much anymore. Turns out that her mother was an alcoholic, is an alcoholic, she's still alive. And so Lindsay Lohan has the hereditary possibility of becoming an alcoholic herself. A measurement of the metabolism or elimination of a chemical is the half-life. It takes 6 half-lives to break a chemical down so that it isn't detectable. Now remember, this is the psychoactive substance is in your blood and it's circulating through your system. So every time it passes through your liver, it breaks it down a little bit, and that's the half-life. How long does it take for it to circulate and break down so that it is half as strong as it was before? For cocaine, it takes 30 to 60 minutes. It will be detectable for 3 to 6 hours. For methadone, its half-life is 15 to 60 hours. It will be detectable for 15 days. THC, tetrahydrocannabinol, the psychoactive substance in marijuana, its half-life is 20 to 30 hours. It's detectable for 5 to 7.5 days. Prozac is 1 to 6 days. It's detectable for 6 to 36 days. Clearing the system is based on many, many factors, so none of the figures are absolute. For you, it may be one thing. For me, it may be something totally different because we're different. We have different physical structures. I'm 70. You know, you're in your 30s, right? You're in your 30s.
Well, it'll be 38.
You're
Next
38.
month.
There you go. Age is a factor in metabolism of drugs. After the age of 30, the liver begins producing fewer and fewer enzymes to metabolize select chemicals such as alcohol and the sedative hypnotic drugs. The more you drank in your youth, the less functional your liver is. Your liver, every time it takes in a toxin, it destroys liver cells, unfortunately. So if you were a drinker as a youth, as you get older, of course, your liver is less functional than it was before. So if you're an alcoholic, you were an alcoholic in your 20s and 30s, by the time you hit your 40s, your liver is pretty damaged. So if you continue drinking in your 40s, you're not going to make it to your 50s. Your liver's just gone. It'll be gone. And that's kind of unfortunate. But that's the way it works. Some people have more sensitive livers than others. What are we talking about here? Well, remember, Caucasians are professional drinkers. These guys have been drinking to excess for thousands and thousands of years. So the people with sensitive livers died out a long time ago. without ever reproducing. So it is kind of like selective breeding. So in most areas, in most places, in most situations, white people probably can drink a lot more than anybody else. Their livers are attuned to consuming alcohol, as far as that goes. All of this has to do with genetics. And as a Caucasian, I probably have a stronger liver than, well, maybe not than you, because you have some white ancestry. So maybe you have a white liver, if you're lucky, or unlucky, I don't know if that's lucky or unlucky. You've got an Irish liver. Race has been shown to be a factor in levels of types of enzymes maintained in the liver. Caucasians tend to maintain enzymes used to metabolize alcohol rapidly, while Asians metabolize alcohol slower and with more side effects, quicker drunkenness, and a rapid flushing of the face. Funniest thing in the world, go out drinking with an Asian sometime, their face turns cherry red almost immediately with their first drink. It hits their stomach, as soon as it metabolizes, their cheeks just get cherry red. It's just the cutest thing in the world. And they get drunk really, really fast. Why? Well, they're Asians. They haven't been drinking alcohol nearly as long as Caucasians have. Caucasians, of course, like I said, are professional drinkers. As fun as that is. Hereditary factors can affect metabolism. Some people inherit fewer enzymes. Some people inherit more body fat to store drugs. Some people inherit a high metabolic rate to help eliminate drugs. Health can affect metabolism when you're sick. You got a cough right now, so if you drank, you would be drunk longer than you would if you were healthy. That's just the way it works. If you
what it is, man, I got like a crap in my throat, but it's starting to break up.
Well, today wouldn't be the day to go off the wagon, let me tell you. An individual's emotional state changes the effects of a drug. Anger or anxiety in a person will if they're using methamphetamines, may cause episodes of lashing out or violence. So the angrier you are, the faster the drug will get into your system, and the more extreme the reaction to the drug. The presence of other drugs will delay the metabolism of select drugs. When alcohol is used with Xanax, the Xanax will stay in the body 2 to 3 times longer than normal. This delay of metabolism and exaggeration of effects is called drug synergism. A lot of people commit suicide when they take sedatives with alcohol. Alcohol will make it stay in the system longer, and it puts them to sleep, and then they're gone. This is Marilyn Monroe committed suicide. Wally Cox committed suicide in the same manner. Some people will die like Heath Ledger.
Marilyn Monroe did?
Yeah, she took a sedative with champagne. She was drinking champagne. Yeah, and that's what killed her. At 36. Not everyone's body chemistry is the same. This is why some people are allergic to select drugs and others aren't. I'm not sensitive to caffeine. I can't take ibuprofen. Opiates don't work on me. It's just because of my body chemistry. I'm different. Maybe it has something to do with the fact that I was an athlete when I was younger. I try to stay relatively athletic. Maybe that has something to do with it. But select things work on me and select things don't. Some people lack the enzyme that metabolizes cocaine, so even a small amount in the system will result in an exaggerated reaction, and unfortunately that reaction is to their heart, and sometimes it will kill them. So some people, snort cocaine by the baggie full. Other individuals, they snort it one time and it kills them. It's just the way it works. This is weird. Other factors that can affect the metabolism of psychoactive drugs: how big you are, the level of tolerance that you have achieved. Like you said, you had a 1.2 blood alcohol and you were driving around without any effect. Monthly hormonal cycle of a woman. When a woman is ovulating, she gets drunk faster. That's interesting.
Really?
Yeah.
Go ahead.
Enzyme induction, enzyme inhibition, the weather can change how drugs affect you. If today it's a sunny day, so if you decided to have to take shots of tequila, you wouldn't get drunk nearly as fast as if it were an overcast day, as weird as that is. Barometric pressure has to do with barometric pressure. The lower the barometric pressure, the faster, or the it changes your body's reaction to things. If a storm moves through, normally I won't get up and pee at all, hardly at all, maybe once a night. If a storm moves through, I'll get up and pee 5 or 6 times.
Yeah, I looked at too, and it's colder. Yeah.
Well, it's the barometric pressure. It's not the cold part. It's the fact that you've got a snowstorm, a blizzard moving through. A rainstorm will cause you to go out and pee a lot, as weird as that is. But it's the barometric pressure. So all of these things can affect the psychoactive substances that you're using.
So what happens if, like you say, you're drinking in the south?